Welcome back to Sasha Said What She Said, where real life, Medicare confusion, health insurance, medical bills, family decisions, and the fine print finally get explained without making your head hurt. Before we jump in, make sure you like, share, and comment. Send this to somebody turning 65, helping a parent with Medicare, or looking at Medicare commercials like, now wait, what are they really saying? Because today, baby, we are talking about Medicare Advantage versus Medicare Supplement.
Good, because those two sound like cousins who show up to the family reunion wearing the same outfit.
Exactly. And that is why people get confused. Medicare Advantage and Medicare Supplement are not the same thing. They work differently, they cost differently, and they fit different people for different reasons. Now, let me say this clearly. This episode is for educational purposes only. Medicare choices can affect your doctors, prescriptions, costs, networks, and coverage. Always review your options and speak with a licensed Medicare professional or trusted benefits counselor before making decisions.
Translation: don't pick a plan just because the commercial had smiling seniors, a grocery card, and somebody dancing in a cardigan.
Please don't. We are not choosing Medicare based on jingles and vibes. Let's start simple. When you have Medicare, you usually start with Part A and Part B, also called Original Medicare. Part A is hospital insurance. Part B is medical insurance. After that, many people have a big choice to make. Option 1. Stay with Original Medicare and maybe add a Medicare Supplement, also called Medigap, plus a Part D prescription drug plan. Option 2. Choose a Medicare Advantage plan, also called Part C.
So, Medicare Advantage is not the same as Medicare Supplement.
Correct. Medicare Advantage is a different way to get your Medicare benefits. Medicare Supplement works with Original Medicare to help pay some of your share of costs.
Okay, so Advantage is like taking a different road, and Supplement is like adding help to the road you're already on.
That is a good way to say it. Let's talk about Medicare Advantage first. Medicare Advantage plans are offered by private insurance companies approved by Medicare. You still have Medicare, but your coverage is handled through the Medicare Advantage plan. You must have Part A and Part B to join. Many Medicare Advantage plans include prescription drug coverage, and some may offer extra benefits like dental, vision, hearing, fitness, transportation, or over-the-counter benefits depending on the plan.
That's the part people love in the commercials.
Yes, the extras get people's attention, and sometimes those extras can be helpful. But you have to look at the whole plan, not just the shiny part. Medicare Advantage plans often have networks. That means you may need to use certain doctors, hospitals, pharmacies, or providers to get the lowest costs. Some plans may require referrals or prior authorization for certain services.
So, if I love my doctor, I better make sure my doctor loves that plan back.
Exactly. Do not assume your doctor is in every plan. Check first. Now let's talk about why someone might choose Medicare Advantage. Some people like Medicare Advantage because the monthly premium may be low, sometimes even $0, depending on the plan and area. Some like having medical and prescription drug coverage in one plan. Some like the extra benefits. Some like having an annual maximum out-of-pocket limit for covered medical services.
So, Medicare Advantage can be attractive because it may feel like a bundle.
Yes, it can feel like a bundle, but every bundle needs to be opened before you trust it. Now, possible disadvantages. The network may be limited. Your doctor may not be in the plan. Your hospital may not be in the plan. Your prescriptions may not be covered the way you expect. You may need prior approval for some services, and plans can change from year to year.
So, don't just enroll and go to sleep for 5 years.
Exactly. You need to review your plan every year. Now let's switch to Medicare Supplement, also called Medigap. Medicare Supplement is private insurance that works with Original Medicare. It helps pay some of your share of costs, like co-payments, co-insurance, or deductibles, depending on the Medigap plan. Exactly. You need to review your plan every year. Now let's switch to Medicare Supplement, also called Medigap. Medicare Supplement is private insurance that works with Original Medicare. It helps pay some of your share of costs, like co-payments, co-insurance, or deductibles, depending on the Medigap plan.
So with Medigap, Original Medicare pays first, and the supplement helps with some of what's left.
Yes, that's the basic idea. A lot of people choose Medicare Supplement because they want more predictable medical costs and more freedom to see doctors who accept Medicare. With Original Medicare and a supplement, you generally do not have the same type of provider network as many Medicare Advantage plans.
So if somebody travels a lot or splits time between states, they may like that flexibility.
Yes, that can be one reason someone chooses a supplement. If they want access to doctors across the country who accept Medicare, Medigap with Original Medicare may be appealing. But let's be fair, Medicare Supplement also has disadvantages. You usually pay a monthly premium for the supplement. It usually does not include prescription drug coverage, so many people also need a separate Part D plan. It generally does not include extras like routine dental, vision, or hearing, the same way some Medicare Advantage plans may offer. And if you wait too long after your Medigap open enrollment period, it may be harder or more expensive to get a policy, depending on your situation and state rules.
So the supplement may give flexibility, but it can cost more each month.
Exactly. That is one of the trade-offs. Now, here is a big warning. You generally cannot have Medicare Advantage and Medicare Supplement at the same time.
Wait, so I can't stack them like coupons?
No, ma'am. This is not a department store sale. You usually choose one path or the other. Path 1. Original Medicare plus maybe Medigap plus Part D. Path 2. Medicare Advantage, which may include drug coverage and other benefits depending on the plan. Now let's use a case study. Meet Mrs. Carroll. She is turning 65. She goes to the doctor regularly, takes 3 medications, travels to see family in another state, and wants to keep her current doctors. Mrs. Carroll is looking at a Medicare Advantage plan with a low monthly premium and extra dental and vision benefits. She likes the extras.
Because who doesn't like extras?
Exactly. But then Sasha says, Mrs. Carroll, let's check your doctors, prescriptions, hospitals, and travel needs first. They check the plan. One of her doctors is not in the network. One medication has a higher cost than expected. And because she travels often, she is nervous about needing care outside the plan's service area. So for Mrs. Carroll, Original Medicare with a Medicare supplement and a Part D drug plan may be worth comparing because she values doctor flexibility and predictable costs.
So she's not saying Medicare Advantage is bad. She's saying it may not fit her lifestyle.
Exactly. Now meet Mr. James. He is also turning 65. He stays mostly local. His doctors are in the Medicare Advantage network. His prescriptions are covered, and he likes having dental, vision, and drug coverage bundled in one plan. He also wants to keep his monthly premium lower. For Mr. James, a Medicare Advantage plan may be worth considering if the network, prescriptions, costs, and benefits fit his needs.
So the answer is not one is good and one is bad. The answer is which one fits your real life.
That is the whole lesson. Now let's compare them in plain language. Medicare Advantage may be a good fit for someone who wants a bundled plan, may like extra benefits, is okay using a network, checks their doctors and prescriptions every year, and wants to compare plan costs closely. Medicare Supplement may be a good fit for someone who wants more provider flexibility with Original Medicare, travels often, wants help paying Medicare out-of-pocket costs, and is comfortable paying a monthly supplement premium, plus possibly a Part D drug plan.
So Advantage may be lower premium, but more network rules. And Supplement may be higher premium, but more flexibility.
Often that is one of the biggest comparisons. But every person still needs to look at their exact options. Now let's talk about the questions people should ask before choosing. Number 1, are my doctors, hospitals, and specialists covered? Number 2, are my prescriptions covered, and what will they cost? Number 3, do I want a provider network, or do I want more flexibility? Number 4, what are my monthly premiums, copays, deductibles, and maximum out-of-pocket costs? Number 5, do I travel often or live in more than one place during the year? Number 6, do I want extra benefits like dental, vision, hearing, or fitness? Number 7, am I comfortable reviewing my plan every year?
Can I add one?
Go ahead.
If I get sick, will this plan still make sense, or did it only look cute while I was healthy?
That is an excellent question. Because the plan you choose should not just look good on paper. It should work when real life shows up. Now let's talk about mistakes to avoid. Mistake number 1, choosing based only on premium. A low premium can be helpful, but you need to check copays, deductibles, networks, drug costs, and out-of-pocket limits too. Mistake number 2, ignoring prescriptions. One uncovered or expensive medication can change the whole picture. Mistake number 3, assuming your doctor accepts everything. Call the doctor, check the plan, confirm it. Mistake number 4, confusing Medicare Supplement with supplemental insurance like cancer, hospital, or accident coverage. Medicare Supplement, or Medigap, is specifically designed to work with Original Medicare. It is not the same as those other supplemental policies. Mistake number 5, waiting until the last minute. Medicare decisions have deadlines. Do not wait until the mailbox is full, the commercials are yelling, and your cousin's neighbor is giving advice at the cookout.
Not the cousin's neighbor.
Yes, because everybody suddenly becomes a Medicare expert in October. So let's wrap this up. Medicare Advantage and Medicare Supplement are two different ways to handle Medicare costs and coverage. Medicare Advantage is an alternative way to get Medicare benefits through a private plan. It may include drug coverage and extras, but may also come with networks, copays, and plan rules. Medicare Supplement works with Original Medicare and may help pay some of your share of Medicare-approved costs. It may offer more flexibility with doctors who accept Medicare, but usually comes with a monthly premium and does not include prescription drug coverage. One is not automatically better than the other. The best choice depends on your doctors, prescriptions, budget, travel, health needs, comfort with networks, and how you want to manage costs. This has been Sasha Said What She Said, where we laugh, learn, and talk about the fine print before the bill starts acting brand new. Before we go, like, share, and comment. Tell me, are you considering Medicare Advantage, Medicare Supplement, or are you still trying to figure out which one makes sense? And remember, Medicare is not one size fits all. Baby, this is not a hospital gown. You want coverage that actually fits.